Our last contestant is Lauren Gase from the Department of Health Policy and Management. She's a PhD student and will be graduating in 2016. The topic of her presentation is Promoting Health in the 21st Century, Transforming the Fielding School of Public Health to Address the Multiple Determinants of Health. Welcome, Lauren.
Most of us have heard the facts, the large differences in disease burden that exists between those at the top of the socioeconomic ladder and those at the bottom. The fact that an Angelino living in Westmont, an unincorporated community in South Los Angeles, is expected to die 10 years sooner than his peer growing up 10 miles away in Culver City. After acknowledging the sadness, the disappointment, and the anger that these numbers conjure up in me, the question I am left with is how? How can we address the unacceptable health disparities that continue to persist in the United States and worldwide? Indeed, what underlies these numbers is a complex web of differences in education, housing, unemployment, environments, working conditions, incarceration, access, and opportunity. If we as public health leaders are to impact the future of health in communities worldwide, we will need a transformation. A transformation to a systems-based strategy that considers the multiple, interconnected forces that shape health and health behavior. So how do we get there? First, we must change the way we think about our role as public health researchers and practitioners. We must expand our portfolio to conduct research and practice on issues outside of what is traditionally seen as the health sector. For example, to work on issues such as improving school attendance or keeping kids out of the juvenile justice system. We must identify opportunities to maximize health through non-health policies, as has been done, for example, in the assessment of the health impacts of full-day kindergarten programs. Second, we must expand the way that we conceptualize and analyze health problems. We must move beyond simple, linear methods grounded in the assumption that none of our predictors are correlated to a complex systems perspective that considers the multiple, interconnected factors that can either promote or inhibit health. We must develop methods to assess the impact of multi-component interventions in order to understand how they can either work synergistically or antagonistically to affect communities. Finally, we must enhance our partnerships. We must elevate our commitment to promoting multidisciplinary partnerships both within and outside the academic circle. This will include partners such as schools, law enforcement agencies, economic development corporations, transportation officials, and planners. To meaningfully engage with such partners, we must first understand and be sensitive to their goals and make the case for the way that improved health can help achieve their aims. We must have the restraint not to always place health at the center of the agenda, knowing, for example, that if more students graduate from high school, that we will see improved health outcomes down the line. Perhaps most importantly, we must shift from a one-way paradigm of top-down research to practice to a framework that meaningfully engages community partners and solicits their priorities for research. I'll close with a story. As a part of a qualitative research project, I had the opportunity to interview Maria, a 17-year-old Latina living in Compton. She is one of 13 siblings living with a mother with untreated mental illness. She's been expelled from her past 2 schools for fighting. And she just lost the only person she cared about in the world to gang violence. Is it surprising that she shows up on the YRBSS as a regular user of alcohol and marijuana? That she goes to a safety net clinic in her community because she can't sleep at night? That she shows up on claims data as having been hospitalized for an attempted suicide? We are at a critical juncture in the way we think about health and its determinants. It's time to translate the research and dialogue about race, education, and place as being associated with health outcomes to pragmatic action. The Fielding School of Public Health has the opportunity to play a central role in training the next generation of public health leaders, conducting research that expands the knowledge base of best practices, and building multidisciplinary partnerships that contribute to true, sustained community transformation. Thank you very much.